Carlos, I mean, that is a very nice question to ask. So I can really roll this out. And I'd connect it back to cybersecurity in a second. So I think that with artificial intelligence, we can actually determine the risk of every single person, whether they're infected or not, meaning that because we now know the risk of everybody, we don't need social distancing, mask wearing, or any of that anymore. And that's what we really need, right? Right now, we're deploying measures. We're doing half lockdowns, lockdowns of schools, lockdowns of or travel restrictions and all this. And everybody's very insecure. And it really impedes our economic life, but also society and business life. I mean, you can see what is happening. The levels of aggressions are going up, and the results are pretty horrible. What we can do with artificial intelligence, because we are able to process data that quickly, we can take the results from testing, as Konstantin has described. And if the testing is available digitally, right, we can take it immediately when the tests have been performed. We can take the results from tracing, so who's meeting who, meaning if we meet, then we exchange risk, right? If I have an infection risk, or you have an infection risk, we meet, we sit together, the risks mingle, and you and I walk away with a higher risk that we're now infected. But if we also do this to symptom control at the same time, meaning that after such and so many days, we've not been symptomatic, we can actually reduce the risk again. So the combination of testing and tracing and symptom control, there is a way to manage risk so that you have a secure bubble. You can have this for a venue, for example, or a trade fair, or an airport, or we could actually use the funnels of airports and airplanes to bring people whose risk we know back to resorts and hotels and events and concerts and all these things. And the job of AI is to do this evaluation of the results from testing and tracing and so on symptom control, on what is actually the risk of every single person. And that way we can manage the risk without having a vaccine yet. And we can determine who can be part of this and who needs medical care, right? And this is a way to get back to capacity in our economy and to get back to capacity in our cities and airports and airplanes and tourism resorts. That's, I think, what we want, without an elevated risk. I mean, right now, we're taking measures out of the system, like we allow people to travel and so on, and then they spread COVID into larger cities, as we see in Germany right now. A lot of that came from travel returns or people who went to some strange demonstrations, right? Now, all of this can be done. And now we've got to ask ourselves the question, should it be done? And the only way to do this is through an anonymous system, right? A digital identity or the digital twin cannot be directly connected to the real person, except for if this person knows and wants. And this is why I think the personal identity should stay right where it is, and there should be a digital twin of this, and only the person can connect it. And I've also said the three ways that are in the system, tracing, symptom control, and testing, all of those need to be secured, right? We need to make absolutely sure that it's impossible to inject wrong data into this, because otherwise the entire risk management collapses. And this is why end-to-end security is just as important as the digital identity combining with the real identity of a person. So we can do this today. In fact, we've been running prototypes at large universities with 100,000 participants, and in an area where there's high infection rate, only have one infected person, right? So this is all possible, but it's only deployable in a liberal democratic system if we make sure that the data is safe end to end. We have to put certificates in, and I'd always vote for putting European certificates in, like you do at WISeKey. And we also have to make sure that there's a digital identity for these people, that they can be identified without revealing all their personal information unless they want to.